So my account right now is set up. It landed on what's called tracked patients. So what we'll talk about is basically the whole function of Seidr. So if you have a particular caseload and like your whole organization or your whole clinic is linked in to Seidr, you can use this feature called tracking patients. So just your caseload pops up on your landing screen like this. As you can see here, this is pretty cool. We have the client name, their date of birth. If there's any missing information, you can see that. Last exam, when their triage score came in, what the triage score is. So this is that feature, so you can really look and get an idea of who potentially needs to be prioritized and seen first. And then over here, your PHQ-9s, your WHO-5s, and your GAD-7s, why those are popping up here. And we will hopefully do this in a later video. But once you do a checkup with your client, that's where the new scores will come in. So that's what this all looks like. If you're in Seidr and say you're going to do a transfer of a client, or you need to look at someone else's data, what you're going to do is go into the search feature, click on that. And if you want to see all of your clients that are in Seidr, you just hit the search button. And that gives you every single client for your clinic or your practice that has done or been set up as a patient in Seidr. And then say we have Hannah Appleseed, say she's going to get transferred to my caseload. I could hit this track button here. And then if I go back to my tracked patients, Hannah pops up at the bottom there because she was my most recently added. If for some reason maybe this client has moved to someone else's caseload or is no longer being seen, you can untrack them to help keep this initial landing page a little bit cleaner. Another piece with this is say you're looking for a specific client, you can search for that specific client just in these search functions. So I know that we have an Ivy Appleseed. Oh, look, there she's popping up. So the first name, I hit search, and then it'll give me all the Ivies that I have for our clinic. So those are some of the basic functions in navigating tracked, not tracked patients, and also all of the patients that would be in your clinic.